Hi there. Do you know what a specific phobia is? Well, I'm sure you do, but because almost 12% of all people have a specific phobia throughout their lifetime, I think it's pretty important to review. A specific phobia is an excessive and unreasonable fear of a specific thing. So some common examples are spiders, thunderstorms, the dark, cats, things like that. Another common example is a blood injection injury phobia. And this phobia is actually pretty unique because none of the other phobias produce a physiological response. Whereas if you have a blood injection or injury phobia, if you're really afraid of blood, can't look at blood, or get really anxious when you see needles, this type of phobia can actually cause a physiological response in which you faint. So that's just an interesting little tidbit. But phobias are pretty common. Lots of people have them. They can happen for a myriad of reasons. Obviously, one of the reasons would be if you had a bad experience with a dog, you might be afraid of dogs in the future. But how can you treat phobias? I mean, it seems like a pretty strong response that the person has when they see whatever they're afraid of. You can treat phobias with exposure therapy. And if you can go on YouTube or something where you can see a video of exposure therapy, it's really phenomenal to watch. And the reason is because exposure therapy only takes about 3 to 4 hours, where the person is introduced to their fear. Say the person is afraid of spiders. So they're introduced to a spider. They don't have to hold it or touch it, but they just have to be in the room with the spider. And during the 3 to 4 hours, the spider is brought closer to them, and eventually at the end of the session, you betcha, they're holding the spider. So this is a very effective form of therapy, and it's a form of flooding, obviously, because they're just flooded with the stimulus. And it really works. What is a social phobia? A social phobia is just what it sounds like. It's being really afraid, unnaturally afraid of social situations. There's a generalized social phobia and an ungeneralized social phobia. The generalized social phobia is being terrified in any sort of social situation, whereas the ungeneralized social phobia is being afraid in only certain social situations. And one of the biggest ones in that subcategory is public speaking, which I'm sure maybe even you are afraid of doing sometimes. But what causes social phobia? I mean, people are shy all the time, but that's not really being unnaturally and unwarrantedly afraid of social encounters. Obviously, once again, there's a genetic component. Some people are more predisposed to do poorly in social situations. And that's okay, but usually social phobias happen because of events that occur at a young age in childhood. So when you were little, say you were picked on all the time, you learned to be very quiet and shy, or people made fun of you. This is going to cause you to retract away from social situations.